A Central Texas compounding pharmacy says some of its medication could be tainted.
Specialty Compounding in Cedar Park is recalling all of its sterile products made since May of this year. But as I learned more about this afternoon, state regulators are scrutinizing pharmacies that make and assemble medications to make sure you are safe. Specialty Compounding in Cedar Park ships sterile medication made here in Central Texas to hospitals and doctors in states all over the country. Now they've voluntarily recalled all unexpired sterile medication sent out since May 9th of this year. The alert came when 15 people in 2 Corpus Christi hospitals got bacterial infections, possibly from a contaminated drug, calcium gluconate, that came from Specialty Compounding. The executive director of the Texas State Board of Pharmacy, Gay Dotson, told me they're working with the FDA, immediately sending inspectors to the Cedar Park pharmacy. But can Texans be sure compounding drugs are safe?
I would hope so. We have some extensive rules. We require special training for the pharmacists that are doing it.
The State Board of Pharmacy is putting extra emphasis on inspecting the more than 100 high-risk compounding pharmacies in Texas, those that make sterile drugs injected straight into the bloodstream. Lawmakers just approved money for the board to hire 5 more pharmacy inspectors, making a total of 12 to watch over all pharmacies in Texas.
Our goal is to inspect the high-risk ones at least every 6 months, to get in there and do something to make sure they are in compliance.
We reached out to Specialty Compounding about the recall today, but they have not responded. However, they did release a statement over the weekend saying, "We deeply regret the impact this recall has on our patients and the hospitals that we serve, but patient safety must always be our first concern." Right now, there's a national push to regulate compounding pharmacies closer as well. A bill in the U.S. Senate now would give the FDA and state agencies more regulatory authority over those compounding pharmacies. All of this extra precaution started after a medical scare last fall when a compounding pharmacy in New England distributed contaminated medication. The Centers for Disease Control say meningitis, fungi or fungal meningitis, really is what it's caused. It was in the medications, connected to 63 deaths in that case, hundreds more contracting the illness from the back pain medication. Now, going in depth, the compounding pharmacy industry has grown a lot in the last few years. Between 2007 and 2012, the industry saw about 5.5% growth each year. That's according to researcher IBIS. Today, it's a $2 billion industry, thanks in part to America's aging population needing medications and shortages of some medications as well.